Good morning, everyone. I'm your host, Vanessa Chong, and you're watching Bella Confidential. As you know, it's the second week of Raya, which means there's still a lot of open houses to visit. And talking about open houses, you see a lot of kids running up and down, running here and there, not sitting down. They can't stay calm. Well, as you know, children are active. You can't blame them. But what if they're actually having ADHD? Well, we'll be talking to our experts to find out more about this and to help us better understand how we can actually help these children. So do stick with us for the next 1 hour only on Bella Confidential. Before we move on to our main topic of today, we're going to go actually to Australia to find out that there's quite an interesting thing where this college actually has a daycare for children. Well, it's not just for the staff, but for those who are studying in the college as well. Let's head on over to Australia.
For many teenagers, pregnancy means the end of formal education. But now, an Australian college is providing child-friendly classes and inspiring hundreds of young mothers to resume their studies. The program at Canberra College is designed to provide academic support, career advice and even childcare. Student Amy Chapman became a mother at the age of 18. Keeping on top of schoolwork was an enormous struggle. She says the program offered a safe environment for her and her child. College Principal Jan Marshall heads the Canberra College Cares program, and she says that it's changing lives. With help and support, the students are excelling. Tamar Deacon is one of 300 teenagers giving birth in Canberra each year. Tamar says she's been able to complete high school, an opportunity she thought lost. With a government promise of $15 million, the new facilities would offer more courses, counseling sessions and an equipped play area for children. Katie Gallagher says construction would start mid-2013. For many young parents, it's the helping hand that they need.
Well, it's great for those young mums out there who still want to pursue their studies. They can actually leave their kids in the daycare, so well done to Australia for that. Well, as I mentioned earlier, we'll be talking about ADHD, or it's known as Attention Deficit Hyperactive Disorder. But to talk about this topic, I have a guest with me. But before I actually introduce my guest to talk about this, let's take a look at what ADHD actually means. Okay, so that's a definition in brief on what ADHD means. But to tell us a bit more about this, and for us as people or for parents or for whoever out there that might have children with ADHD, let's please welcome Vilasini Surendran, therapist at KidzGrow.
Hi, Vanessa.
Hi, thank you so much for coming on to
You're
Bella.
welcome.
Very young, beautiful therapist.
Oh, wow, thanks.
Well, looking at the definition right there, it's a short, brief one. Maybe you can explain to us a little bit for those who don't really know what ADHD is.
Okay, ADHD stands for Attention Deficit Hyperactivity Disorder, like what you've seen earlier. So basically, kids with ADHD, they are very inattentive.
Okay.
So they're very hyper.
All right.
What I mean by they're very hyper is that, you know, normal kids, they are hyper, but kids with ADHD, they're extremely hyper, that it disrupts their learning life, if it disrupts their family.
All right.
Yeah.
Okay, so there is a big difference with children who are active and ADHD. So what's the main clear difference with a normal child who's active? Because children are active, they run here and there. But with a child, what's the clear significant difference?
The clear significant difference, like what I said, is that it disrupts their learning, it disrupts their family. They have a lot of trouble in class, they have a lot of trouble coping. So then they fall back in their academics. Because
their attention span is very low, is that right?
Yes, their attention span is very short, so they're unable to focus for a long period of time. When they're unable to focus, they tend not to be able to read or write, so they fall back in class.
I see.
Or they might disturb their
other kids. All right. And looking at ADHD, is it something that's developed while the child is actually growing up, or is it innate, like during birth?
It's actually innate based on research that I've read.
Okay.
It's due to there's no main cause, but it's actually quite tied down to biological factors. Like they did a comparison study and they found that kids with ADHD, they have a smaller prefrontal cortex, which is important for attention and thoughts.
Okay. Oh, looking at the brain surface, like where this is for what part? I mean, for...
Yes. So it's the part for attention that is smaller as compared to their peers of the same age.
And usually when would you know if a child, like what are the signs? Like from how old, or what are the signs would parents need to know, or even teachers out there?
Usually those diagnosed with ADHD, they should show these symptoms before the age of 7.
Before the age of 7?
Okay. So some of the symptoms that you have to look out for is that they're very inattentive in class. When spoken to, they don't reply, or they just... You might think that they are ignoring you, but actually not. They just can't really focus on what you're saying. They might not. They cannot remember things. They're very unorganized. They're very hyper. They just run around haphazardly.
So it's not that they're... So parents or teachers or people dealing with children like this, and if they don't know that they have ADHD, it's not necessary that the kid is naughty, right?
It's not necessarily. Actually, they don't do it on purpose. It's just that they just have a lot of energy and they have to find a proper place to channel it.
Okay.
Yes.
Because they're just out there, especially, but you can't blame parents if they're not aware of this thing like ADHD. Like sometimes you might see a child and you go like, oh, he's very hyperactive. But is there a difference? I mean, active, hyperactive and ADHD?
Usually kids with ADHD, they are hyperactive. Like what I mentioned earlier, it disrupts their family.
Everything else.
Yeah, so the parents, they pay a lot of attention on the kids, and that it disrupts their life, their personal life.
So you say you start seeing the signs before the age of 7.
Yes.
So obviously, but of course, when they go to school, it's more obvious because they're learning and everything. So even when they're 2, 3, you will know, because 2, we always call it the terrible 2s. I know my mom, because there's 6 kids in the family. She calls it the terrible 2s. You can tell from there as well?
Usually 2, they are hyperactive, and also we see about like 3 or 5 or even 6 years old, about there, especially when they go to kindies and all. That's where you see how they cope in class.
Yeah. But like children from, because 2 to 3, 4, that's when they start learning to talk more and everything. Does it affect their ability to talk? Would that be one of the signs, or they're just like any normal kid, they'll be able to talk? It's just that they're more active.
Yeah, some of them, most of them, they are able to talk, because talking you have to listen. And you do have certain words, but those that they can't able to focus their attention on listening, their vocabulary is not as vast. Yeah.
So that's some of the signs parents can look out for. And another big question would be, yes, it happens in kids, because kids obviously are running here and there, and they need to be controlled a little bit, but can they actually outgrow ADHD?
Well, you can't actually outgrow ADHD, but you can compensate for your activity as you grow older. For example, like Michael Phelps, he has ADHD. So when he was younger, he did a lot of swimming. So he actually liked swimming, and so he focused all his energy on swimming. So look at him now; he's got a goal.
Definitely. So it's about channeling that to it.
Yes.
Like putting your child, letting them do some form of activity
that they like. So when they actually like doing something, they would give it their all.
Okay.
Yeah.
So if a child with ADHD, can they go to, like, when I say normal schools, meaning schools with everyday regular kids, is it, they do, right?
They do go to school, yes, with normal, with their peers and all. But teachers might find difficulty, like, coping with them, because they do run around and all, and they tend to disturb their peers because they aren't able to focus for a long time. So, yeah, teachers, they do need to give special attention.
Which sometimes is hard, obviously, in some of the local schools where there's so many students in one class. So would parents actually have to give maybe extra like tuition or things like that for these children?
Well, extra tuition, not really. Because you're not providing extra tuition, you're still giving them a lot of information.
Too much information? They can't digest it.
Yeah, so their attention span is about 10 minutes. So what teachers can do is that you cut the the work down for them, like make it into segments, short segments, then let them take a break and just do some exercise and come back and continue your work. Yeah.
And the most important thing, obviously, it's understanding and actually acknowledging that your child or you yourself have ADHD, right?
Correct, yeah.
Yeah. So thank you so much. We'll continue this conversation because we want to learn a bit more about ADHD because there's so much more that we need to talk about. So Bella will be going for a really short break. Don't go anywhere because we'll still have Vila on the show with us. That's right, we'll be discussing further with Vila on this attention deficit hyperactive disorder, what it's all about, and if our children are actually facing it, all this and more when we return. Welcome back to Bella, and as you saw, there's some myths and facts about ADHD. We're talking about attention deficit hyperactive disorder. As you saw just now, we got to learn a little bit about what ADHD is. It happens in children. As you saw the myths and facts just now, want to comment a bit about it? Because are there types of ADHD?
Yeah, there are actually 3 types of ADHD. First is ADD, without hyperactivity. So they're not actually hyper, they're just very inattentive. Yeah, they can't focus, they are just very dreamy.
So how they don't run around, these kids?
They don't run around, they just sit and they daydream.
They sit and they daydream.
Yeah.
So these kids don't run around, they sit and daydream.
Yes.
But it's similar sort of symptoms, but
it's because they aren't actually focusing, so they aren't paying attention. So that's ADD. And then there's ADHD with hyperactivity and impulsivity as well. So they can't wait. They don't know how to take turns. They are very impulsive. Like when somebody is talking, they interrupt.
It's like impatience. They interrupt.
Yes. Yeah, they're very impatient, and yeah, they run around everywhere haphazardly. And then there's a combined ADHD, which is the most common ADHD, which is a combination of ADD and ADHD.
Wow.
Yeah.
So that combination, what's the big difference?
The big difference?
Yeah, like ADHD together with ADHD, so it's combined, meaning so that they're not focused and then they're active.
Yeah, when they're running around, they're just not focused, or when they're just like they actually have an interest. So when they are focusing on that certain thing, they just cannot focus on
anything else. That's interesting. So I have a friend like that. She says like once she focuses on something, she just focuses on that, and everything else is not is boring to them, right?
Correct,
something like that. So that is a part of ADHD.
Yes, it is.
Okay. So I wanted to ask you another question. Obviously, once we understand now, we understand a little bit what ADHD is all about. So what must parents consider once they know that their child actually has ADHD? What are the first steps or first few steps that are important for the parents?
Okay, the first thing that you should do is you have to consult a physician just to opt out that the physical condition is not causing the symptoms. For example, like maybe kids that they don't listen well to instructions, they might have like their ear wax. They might have problems with that, so that inhibits them from listening carefully. So these are like certain physical conditions that you have to opt out. That
I see. So what you're saying is they might have a lot of earwax in their ear, so that might not be ADHD.
Yes, it might be that causing them to be inattentive. Yeah. So or maybe like a child that has diabetes, so they're very lethargic, and also you might think that they're being inattentive. So you have to rule out that first. And once you know that they're diagnosed with ADHD, you consult their school teacher. You talk to their school counselors. Maybe you can come up with a like an individual program for your child. Yeah.
That's interesting because it's very important. So I think accepting it is very important for parents to understand what their child is actually going through so that they can move forward and learn. And knowing all this, basically, is there any therapy or medication? What can we do? There's no cure, right, obviously? Like you say, you can't outgrow it.
Yes, there's no cure, but you learn how to compensate. So like some of the therapy that you can do are like behavior therapy because you have to discipline them as well.
Okay, because they're still kids. They still need to be obedient, right?
Okay, so, and then you have medication, okay, but most physicians, they tend not to suggest medication because it's just for a short term. But medication and intervention together, it might work for the better. Okay. Other interventions are like sensory integration. Like actually, kids with ADHD, their brain is less aroused. Okay, so it's less stimulated. So what we do at sensory integration is we provide stimulation to them. So when they are stimulated, they'll be more focused. They'll be more aware.
All right.
Okay, so that are some of the things that we do at sensory integration. You can also get them to do more exercise or martial arts, so that it's a way for them to channel their energy. You see.
Channel it into the right form.
Yes.
Another question I want to ask, which is definitely something which any kid, you find it hard to put a child to sleep anyway.
Yeah.
Whether it's a kid who doesn't have ADHD. So, being as this child, we're talking about the one with that are hyperactive. How do you put them to bed? How hard is that?
It is a challenge, definitely. So usually we make them channel their energy, make them a little tired first. So bring them to the playground, get them to just play and release all your energy. And what we do at KidzGrow is that it's a gym-based program, so we do a lot of exercise with them. They jump on the trampoline, and
so you have all these things, trampoline, stuff like that,
and even playing ball. So all that, it will actually make them a little tired. And when they are a little tired, they're more focused. And we even have this therapy. It's called the brushing therapy. Maybe you can have it googled on Facebook. It's like these kids with ADHD, they go around seeking for stimulation. So that's why they're very hyper. They go around, seeking for. So we provide them with this stimulation. So sometimes we see that when we brush them, they would tend to calm down.
Use a normal brush.
No, that's a
you provide a nice soft brush.
Corn brush, it's quite soft and nice. It's very calming and relaxing. So when we brush them, they tend to sleep better.
I see. So parents could actually, obviously at KidzGrow you have all these things, and so parents would go there and then observe all this as well. But what can they do at home? Obviously at home, like some of the activities, like you were saying, send them for martial arts. But what sort of games could maybe parents help do with their child when they're at home? Is there anything that you could?
They could actually just play along with them and help them release their energy. Go to the playground, you play with them. Like even these brushing techniques and all, we will teach the parents so that they could do it at home, and we will provide homework for them to do at home. So the homeworks are just like jumping and simple ball skills and so forth.
And then together with obviously the sleep, as every child, every person, you need proper diet. So is diet very important? Because for me, example, feeding a child sweets is already a big no-no.
Exactly.
Right? So it gives them even more. So what would be the proper diet for children with ADHD? Is there any proper diet?
Actually, it's just the same as normal children. You need to control their sugar intake, their carbs, and especially food with colouring.
Colouring?
Yes, colouring.
What's the reason behind that?
They would be, this is based on research. What I've read is that they tend to be more hyper.
So all that affects them as well. Well, we have quite an interesting video to watch as well. It's basically a mom who's ADHD and children, her two kids that she has it as well. So let's take a look at this.
I think the first thing that you need to think about when you're a clinician dealing with parents who also have ADHD is that these parents have a disability.
Dr. Angel Adams is a clinical psychologist and an ADHD specialist. She is out to help Charlotte, who is suffering from ADHD, and her children are having it as well. According to Dr. Angel, not many people understand what they go through, and they think that parents with ADHD are lazy.
They don't have the ability to retain things in their memory. That's what we call a working memory deficit. So they've got a lot of odds against them, and unless people really understand how difficult it is, they're going to just judge them and say, oh, they're lazy, they're stupid.
The first step that Dr. Angel did was to set lists in the household. Dr. Angel notices Charlotte's inconsistency when it comes to parenting the children, so she suggested that the family to have a token system which is very helpful for ADHD children.
You have a little plastic jar and you're putting in tokens that they're earning for certain
A certain amount of these make up.
Yeah. But see, they're immediate because they're going in.
Now, after 3 weeks from Dr. Angel's first visit, the list seems to be working. And according to Charlotte, it makes her life less stressful.
I just feel so much calmer now most of the time, and I think having the structure, I'm actually surprised in the morning how much time I've got. That sounds silly, but when everything's organised and you've got, oh, you do this at 8 o'clock, this at, or, you know, you get up at this time, there's actually more time and it's not as rushed and as stressful.
These are among the methods that are being used to help people with ADHD. Understanding what they are going through will make us more alert and aware of how to work around them.
Well, we're talking about ADHD, and as you saw from the video right there, it's a mum who has ADHD, also children with ADHD.
Yeah.
So again, we saw that there was structure. It's very important. But the question I wanted to ask you is, can it be passed on?
Yes, it is hereditary. It can be passed on.
Oh,
yes.
okay.
Like at KidzGrow, before you actually come for an assessment, we would need parents to fill up a form.
Okay.
So based on that, we would ask them if there's a history of learning difficulties.
That's right.
Yeah, in their family, and most of the time,
There is.
Yes. Yeah.
So basically, but I heard also children with ADHD can have really high IQ levels.
Yes.
But
they do.
as that to compare to, and then having learning disabilities, how does that work? I mean,
they do have high IQ levels, but just that because of their short attention span, it inhibits them to grow to their
full potential.
Yes, exactly.
So what are some of the learning disabilities that they might have?
Some of the difficulties that they might have is like copying skills or reading or writing, because they need to sit down still and focus in class, but they're unable to do so. So that's why they have these certain difficulties.
And looking at that, obviously children with this, like you were saying, Michael Phelps put his whole energy into swimming and he became one of the best, Olympians out there. So do you think that children with this sort of disability or this disorder, could there be a different way for them to be educated, or different sort of things where they can just excel in, as compared to the normal system that they're learning?
Yeah, definitely. They have to find what they are really interested in.
Yeah.
So once you find that, and then you work on it.
Yeah.
So, but you should know that you should not neglect your weakness as well.
Okay,
you
so
have to
that's
work
not
on
an
it.
excuse to avoid the weaknesses that the child has as well. Because they can.
They can. They definitely can.
Okay.
So that's why early intervention is very important. You have to start early, get them assessed, find out, profile their strengths and weaknesses, find out where are they actually weak in and what areas are they good at. So you work on their strength and also help them out with their weaknesses.
Awesome, that sounds great. Well, we'll be going for another short break, but we still have Vila on the show, and she'll be joined by another expert to talk a bit more about ADHD. So we'll be right back. Now that we have a better understanding of ADHD, we're going to take a look on how parents can actually help their children and what are some of the issues faced by parents and how they can overcome this. See you right after this break.
Hi, this is Daniel Day Kim, and you're watching Bella on NTV7.
welcome back to Bella. And as you saw, we have some parenting tips on ADHD. We've been talking about attention deficit hyperactive disorder with our guest Villa earlier on. But to continue this conversation, we've already gotten to know and understand a little bit more about ADHD. Now we will need to ask more advice on how parents or the whole family as a unit to help these children with ADHD. So joining Villa from a therapist from KidzGrow, we have Supia Saad, lecturer of special education subject UIA. Thank you so much, Supia, for coming on the show. And of course, I'm sure you've been listening to our conversation earlier about ADHD. I wanted to ask one question, but it's very key, right? Acceptance. I wanted to ask, I'm sure both of you, but I wanted to ask Villa as well. What are the parents' reactions sometimes when they find out that their children actually have ADHD?
Usually when they come into our center, they are already accepted.
They've already accepted it, okay.
Because they're actually seeking for help.
Okay.
Okay, so, but there are cases where parents are in denial, where like their schools refer them to us.
I see,
so,
understand, yeah.
So when we show them the results, they are quite defensive.
Defensive,
yeah.
Which I'm sure happens a lot. I'm sure you know as well, Supia. Like the parents who are in denial and defensive, it doesn't help the situation, right?
Yeah, actually, parents, once they know that they have a special child, normally they will go through a few phases. You know? First, they will deny. Of course, the denial period. Then, after that, they will get angry. They love the kids.
Who are they angry with?
They're angry with the disorder.
Disorder.
Why my kid?
Yeah.
What have been done?
Yeah.
So I
It's that sort of
this, you know?
why me?
Yes.
Well, we also want to ask you out there, if you want to give us a call, if you've experienced this or you have friends who've experienced this, do give us a call. We have our lines open. Call us at 0355690349 while we continue our conversation. So that is one anger.
Then after the anger, they will go to another phase, which is we call the blaming period. You know,
blaming
they
period.
blame others for small things. So they blame the teachers. They blame neighbors. They blame maybe the spouse as well. You know?
Yeah.
So after that, they will get to the other stage. We call it grief period. You know.
Wow.
So they feel pity, feel sorry for the kids.
Yeah.
And after that, at the same time, goes hand in hand with the worried period.
Yeah.
They worried what will happen.
The child's future, what will happen.
The future. Then after that, they will go to the acceptance or coping level. Normally, some parents will get to the acceptance level very fast. Maybe
very
3
fast.
months. Some only 3 months. Some take years. But it's experienced after the kid is already 16, 17 years. The parents still at the blaming period.
Blaming period. So it's so important for us, if we want our parents out there or whoever have children, to accept it earlier. Because how important is it for parents to accept their child with the disorder earlier than later? How important is it, Villa?
The earlier they accept it, the better, so that they can start early. Early intervention is important.
So once they accept, the teachers can start to plan earlier. And they will cooperate with teachers and schools. So what have been done in school, they continue at home.
Yeah.
So because ADHD is, we must remember, not some ADHD come with other disability, right? ADHD plus autism.
That's
ADHD
right. There's many different levels.
Dyslexia.
And
the pure ADHD also, some have a very mild symptoms. They can cope with on their own.
Yes.
But some with moderate symptoms and some with severe.
Because there's many different levels. Well, we have Marina on the line from JB. Marina, hi Marina.
Hi, good morning.
Hi, do you have a question or is there something you want to share with us?
Yeah, I just need to ask to the panel, is there any similarity between this ADHD and what we call learning disorder? I understand that there are some autism characteristics for these kids who are unable to speak, or they call it speech something?
Bit of speech impediment?
They are able to speak. They say that they are later in communication. They have some trouble in communicating, some trouble in like learning disorder. I think maybe SID. Maybe they know about SID.
What was that again?
SID.
SID.
Sensory integration disorder.
Sensory. Yeah, is that is there any similarity between this?
Okay.
Because I have a kid which I need to seek for help from the OT. They call it occupational therapy. Yeah, so I need to know this.
All right.
Is there any similarity? Thank you very much.
Thank you, Marina, for that call. Thank you so much. So, listening to Maria, who would like to answer some of her questions?
Like I just mentioned earlier, ADHD comes with other than that, but there is a lot of cases where the symptom is just like mimic the other disorder. So
is it a different disorder that she's talking about?
But the parents need to send the kid for a proper diagnosis.
Which is like what Vila said earlier. You have to send them for proper diagnosis, because it could be something physical, it could be something else.
Yes.
Right?
So then they can rule out the problem that not related to ADHD. Because ADHD intervention is different from other intervention. Because it's more on behavior. Yes, like a speech problem, they need speech therapies. Yes. So sometimes if they come ADHD plus speech problem plus other problems.
But there are children with ADHD who might have speech problems.
Yes.
There is as well. But again, you have to go for proper diagnosis to the proper physician to check it out. And of course, children with ADHD, as we mentioned earlier, they're very hyperactive, sometimes very compulsive as well. You know, they do things whenever they want. They're focused on one thing. And knowing that they have a high IQ and everything, but how do they interact with the society in general? Is that hard for parents to accept that their child is different from other children?
Yeah, if we can see that parents always feel very sorry to take the kids out.
Yeah.
So what they can do, I think, be a role model to the kids, discipline them from the beginning, and some parents also have ADHD.
That's right. Like we saw on the video earlier. That's right.
Then they must be very careful with the medication, for example. Make sure that the kids take the regularly.
That's right.
The medication regularly.
Medication and everything.
And plus the psychosocial treatment.
Yes.
So it's cannot be done alone.
Cannot be done alone. You need a group.
You need the teachers, you need like you mentioned, the siblings.
And everyone around them.
Yes.
Well, we have another caller, Sasi Darren from Bangsa on the line. Hi, Sasi.
Hi.
Hi, do you have a question or something to share with us?
Yes. I have a question.
Yes, go ahead, Sasi.
Okay. My question is, I want to know, when there is a competition where I enter, then I'll be like speechless and become very nervous. So is a symptom of ADHD or what?
Okay. Sasi, how old are you, if you don't mind me asking?
21 years old.
You're 21 years old. Okay,
yes.
We'll find out from... Is that all? Is it when you're going for a competition, or since you're young?
Sometimes for speaking competition or debate and things, I become speechless, sometimes I become nervous, and I can't speak well, and it really affects my voice projection. Yes.
All right. Thank you, Sasi, for sharing that with us.
Okay.
And thank you so much. Well, Sasi there with the question. Yeah. So what do you think from that?
I can actually relate to Sasi because I used to be like that as well.
You used to be like that?
Yeah, I used to be very nervous to give presentations, but with more practice, I've learned to overcome it. So I think, Sasi, you should practice more. You should enroll yourself for more debates and more talks, and just try to relax.
Look at Vila, look at her. She's actually here talking on a TV show. But do you think she was asking about ADHD? Do you think?
I don't think that's a symptom of ADHD.
Yeah. So again, maybe better go check, if not sure, but because I'm sure they would have known from young. But that's a good one, being more confident. Thank you so much for. Well, I hope that helped you, Sasi, right there.
Actually, there is another disorder. We call it anxiety disorder.
Oh yeah, anxiety attack.
Yes,
that's
anxiety
what they say,
disorder.
Right?
If you remember Haziq in the what we call it, Academy Fantasia. He has that
anxiety
disorder, but he can overcome that.
He can be overcome. So that's something totally different, obviously. But how important, like moving back to the topic on ADHD, as we said, parents, not just parents, the teachers, very important, because that's where they go to study and learn, siblings around them. But is there a support group I mean, on your side, is there a support group for these parents to sit, discuss with other parents?
There are support groups available, but at KidzGrow, we are still we are just heading towards that. But we do have like parents asking us for for contact numbers of other parents because they would like to share it more personally. So we would ask them if it's okay, and then they would do it in a more personal
way. But it is important, right, to be able to share, because it's not just you. Like you said, once you find out and you're at that acceptance stage, knowing that there are other people out there who actually are dealing with this. Well, we have another caller, Shelley from Semenye. Hi, Shelley.
Hi, morning.
Morning.
Okay, I have a son, 7 years old. Right?
Okay.
We sent him to Chinese school. So the teachers keep on complaining that he don't follow instruction, and he say that he is living his own world. You see, so we get shocked. So then my son also used to be like to climbing the grill, dog grill, so active until we cannot understand for it. Then we try to teach him a lot of things, but he cannot concentrate. So some of my relatives see that when he draws something that's very special, so they ask me to send him to like IQ tests or to doctors. So we're not sure whether he is ADHD diagnosed or gifted children.
Okay. Thank you, Shelley, so much for sharing your story. We'll talk to Pia and Vila on that. So thanks, Shelley. So it sounds, I mean, I'm not an expert, but from listening to that, what do you think?
She should...
sounds quite, could be, right?
Maybe go and get him checked, get him, take him to a pediatrician or clinical psychologist to just get him assessed.
So, and obviously, because like I said, active and all things like that. But so, looking at that, how do parents themselves learn to cope with this? Like, you know, I heard somewhere that they need to be patient, obviously have a sense of humor, self-care, taking care of themselves. So parents, we know children with ADHD, this is what happens. But how about the parents themselves?
Children with ADHD can learn better in one-to-one situation. So if in school is it quite impossible to get that one-to-one interaction with the teacher. So parent can do that. Parent can sit with them, stay at home for quality time with the kids. So maybe it's help a lot.
And I think the parent will have a better understanding of their child. Because even though ADHD, it's in general, the symptoms might be the same, but each child is different, right? And unique, even ADHD. So different disability, they might have different learning disabilities and stuff like that. So how do you actually help them with that learning disability? What sort of disabilities might they have, children with ADHD?
Okay, if, like I just mentioned, some children not come alone. ADHD is not alone. They come with like autism, dyslexia especially. Dyslexia can cause learning disability. So they need one-to-one. So parent can detect what is the strength of the kids, so they can tell the teachers. The teachers can start to plan from that strength. Avoid to focus on the weakness. Weaknesses.
Don't focus on the weakness, but help them with their weakness.
With the strength.
The strength more.
When they feel they feel the first failure in academic, especially the self-esteem will drop. And the longer that they are in that condition, they will get even sometimes the self-esteem.
Because that's so important to help them from young up to their adulthood. Well, we have another call, Muniandi, I think. Hi. Muniandi? Hi, Muniandi. Do you have a question or something to tell us?
Something to tell us about my family.
Say again, sorry?
My family got problems with my kids.
Okay.
When we tell them they cannot follow the word, always call father and parents on.
Okay. Continue? Is there anything, so it's with the family?
And sometimes they make simply noise, everything. They do own self.
Okay. So this one, the children are scolding the parents, right? That's what you're saying, right? Okay, okay. All right. Thank you so much, Moni Andy. Wow. Oh, that's well. Nowadays, children do scold their parents.
Yeah.
But is this one of the symptoms, or?
It's actually usually when parents find out that their kids have certain disorders or something, they tend to feel a little sorry for them, so they give in a lot.
Too much.
Yes, when they give in too much, that's when their roles change. The kids, they become the boss. Yeah.
Yes, which is not good.
It's not good.
So basically, even if your child has ADHD, they're a special child, obviously. Do not let them be in control of the situation. So tell us, is there any last advice that you would like to, Vila, give our viewers or parents out there that their children might be having ADHD? Maybe you can tell us what's the key things.
Okay, if they're very hyper, if they can't sit still, you think that they're not paying attention to you, that they're not listening to you, just bring them for assessment, profile their strengths and weaknesses, and start early. Early intervention is very important.
Very important.
Yes.
And Supia, for you, one key thing for our viewers to understand?
We have symptoms for ADHD, that 3 types mentioned by Vila. But these symptoms, if we didn't give them the proper intervention at early stage, they will develop another symptom, that secondary symptom we call it. And that secondary symptom sometimes overlap with another disorder like conduct disorder or
and all those things which can
disorder. And so there is, I think,
repercussions when you don't do early detection or help them out. So thank you so much, Vila and Supia, for sharing with us. So parents out there, don't be embarrassed if your child has ADHD. You know, go give them early, help them out earlier. So thank you so much to our guests once again. Well, Bella will be going for a really short break. Don't go anywhere because we'll be right back after this.